Welcome to Michigan Reimagined, presented by T.A. Forsberg and Wagoner Financial. And here's your host, Chris Buck.
Healthcare is a hotly discussed topic, and there's a new practice in mid-Michigan whose tagline is supporting health, not just treating disease. Here to discuss the techniques and the refreshing attitude is the founder of Wellness Alternatives in Okemos, Dr. Janet Ng. Welcome to the show, Janet.
Hi, how are you?
I'm fantastic. I'm excited to unpack your story and hear a little bit about how this all got together. So, can you share with us a little bit about your history in healthcare and kind of what prompted you to begin your own business as opposed to working in traditional medicine?
Absolutely. So I like to tell people that I'm actually a recovering emergency physician. I've been practicing emergency medicine for the last 30 years. And then I also did a fellowship in medical toxicology.
Wow.
So with toxicology, I got to learn how all the things around us break down our system and cause healthcare problems and injury and disease. And so the other thing with the emergency department was I saw a lot of people coming in with hypertension, diabetes, younger patients coming in with heart disease, cancer, those types of things. And I thought, there's something going on with our healthcare system. I need to look into it deeper. And so I started learning about functional medicine. And I started practicing probably back in 2014 with functional medicine, working with more diets and supplements.
Okay.
And it was like putting premium gas into a broken down engine. I got people feeling a little bit better. We got going a little bit better, but I couldn't really get them across the finish line or keep them across the finish line. Then COVID hit and I went back into the emergency department. And then post-COVID, I came out and I thought, you know what, I'm going to start looking more into the engine work. And that's where I started learning more about the PEMF and the photobiomodulation and more the energetic things that I do. And so that's where I'm at, is the engine part of healthcare, and try to learning how, all the enzyme systems that I learned that broke down from different things. I now realize those same enzyme systems we can support and keep us healthy.
Huh. Okay. So when you say functional medicine, what exactly do you mean by that? It's in your website pretty prominently, and you just mentioned it, but how would you kind of summarize what functional medicine is for the layperson?
So functional medicine is just how do we function? Their structure and function is all interrelated. So the function part is how do we keep our systems going? How do we keep our enzymes going? How do we keep our digestive system going? How do we function better?
Okay. And that is obviously a lot of diet and exercise. I mean, to kind of keep that engine going, is that? It's
a good start. Diet and exercise is always a good start, but then there's the mobility work, there's the strength, there's actually looking at deeper into the enzymes as to why, because everybody has a different genetic makeup.
Okay.
And the things that we're exposed to in our environment can also affect us.
Right. And your philosophy on, I love your metaphor about the car, and I use that somewhat regularly in other ways. But, traditional healthcare seems to be more fix me when I'm sick, whereas you seem to be really, this whole endeavor of yours seems to be leaning towards prevention.
Yes.
And obviously people show up wherever they are. So you're going to help whatever has made them not feel as good as they could feel. But it's really more about prevention and looking forward as opposed to you're sick, here's a pill.
Right. And it's a lot of work because we all want that. You're right. You're sick. Here's an easy fix. Take this pill. And then I'm trying to promote, you want to stay healthy. It's going to take a lot of work and just changing mindsets and where people want to go with that.
And so your website has a ton of different information about the services that you provide. Can you pick maybe a couple specific either processes or treatments or applications that you do that you think kind of get people off to the right start?
Right. So one of the first things I do is body composition testing. And the way I tell that to my athletes or people that just come in for wellness, they want to lose weight, they want, however they want to feel. You can't know where you're going if you don't know where you're starting from.
Okay.
So I use body composition to tell me what is your weight, what is your muscle mass, what is your, fat mass, et cetera, et cetera. And then I go from there and I look at resting metabolic rate and VO2 max. And what those things do is they look at how does your body burn calories? And then on the VO2 max, like how do you function? And we talk about different zones, like where your heart rate should be and then where you really stress out and where people function better in this aerobic, meaning oxygen state, versus anaerobic, where you're pushing it and not getting the oxygen. So we want to look at those types of things.
Okay.
And then, we look at, once we know where we're starting from, then how do we get better? So those are different things like using the PEMF and red light, and that helps with microcirculation, and that helps with like ATP production, which is ATP is the powerhouse of the cell. That's the energy that makes your cells go. So I look at that, but then I look at, okay, what else is going on? There's injury prevention, and that's where microcurrent that I use really comes into play, because the microcurrent, think about it as all of our cells have a certain frequency. Like, think about your cars out there. When we walk down the street and you hit your car fob, not every car unlocks. It's a certain set of frequencies for that car.
Right.
So your cells are like that too. So there's different frequencies for like inflammation and health, and there's different things for nerve. So I have learned through Carol Wink-Macon about frequency-specific microcurrent, and that works really well for not only taking care of injuries, but injury prevention. And one area where I really like to use it is it really helps with all of us because we are so sympathetically driven. So that's the fight or flight mode. Right? Okay. So think about back in the ages where you're an animal just grazing, and then a lion comes along and you run.
Yep.
Right. You run from the tiger, and then you stop, and then you're grazing again.
Right.
But we are that animal that's constantly running, whether we're driving in the car, whether we're driving in the rain this morning, someone cuts us off, we have a bad day at work or the computer, we're all this sympathetically driven, and that's where we have the fight or flight. So you're not getting the opposite side, which is the parasympathetics, which is your rest, digest, and heal. So that's where the microcurrent works, is that kind of helps put you back into balance, to put you back into rest, digest, and heal, and to calm things down.
Okay, so as a father of a couple of young 20-year-olds, with what you just said, does the advent of like social media and chronically being connected, and I mean, it's not just 20-year-olds, it's me too, but there's a lot of evidence that just never shutting down, never having a chance to be bored, to kind of digest all of the input that you're giving to yourself like we used to have before we had the internet in our pockets. Does that feed into the problem that you're trying to fix?
Absolutely. Absolutely. Because we never turn it off. We're always on our phone. And even if you're just playing that mindless game, it's still that stimulation. It's input.
And there's never a chance to not have input. We're chronically giving ourselves input.
Correct.
Fascinating. Okay. Well, I want to give a nod to one of our friends of the show. When it comes to creating the best living and working environments for the community, no one does it better than my friends at the Forsberg Real Estate Company. Brent Forsberg and his team create vibrant, holistic communities that inspire growth and encourage belonging. Focused on building stronger connections for people, the Forsberg Project is always in tune with balancing relationships to create the optimum human experience. Since the 1950s, Forsberg has been enhancing the quality of lives in the communities they serve by following the principles of regenerative growth and aligning the resources and tools available. Reach out to my friends at the Forsberg Real Estate Company by calling 517-349-9330 or check out their website at lansingrealestate.com. So if I'm a listener and I've heard everything that you've shared so far, I guess what is the call to action? You know, I mean, what should a person be reflecting on to say, I'm not where I want to be, or here are some things that I'm just kind of mildly dealing with that maybe I don't need to deal with, and my life could get that much better if I went and talked to Janet Eng.
Right. So I got my start working with athletes because, I have 3 kids and they were all in sports, and I think that's where I got my interest. But when you really look at it, we are all athletes. Whether we are on a sports team, whether we are a golfer, a hockey player, a lacrosse player, or whether we want to be able to get up off the ground after playing with our kids. Here's the other one. If you want to be able to put your carry-on luggage in the overhead bin, right? It takes like skill, balance, strength, those types of things. We are all athletes. So that would be the call to action is, where do you want to be? Where do you see yourself? And that would be the call to action, is that we are all athletes. We all need to move. We all need to feel better. We all need to work on ourselves. And so that would be one of the things that I say, come check me out.
Got it. And what kind of, you're a doctor by trade. You obviously did a bunch of emergency room stuff. And then you mentioned you did some additional work after you left the emergency room. What was that discipline? Right.
So I did the functional medicine, integrative health, and then we also call it precision medicine. I have also worked in the insurance arena, and I took a look at that, and currently working with another company as their medical director, looking at toxins.
Got it. Okay. But I guess my question really is, what have you learned outside of, say, a general practitioner or even a cardiac specialist or whatever that helps you be educated in this particular discipline?
Right. So there's a lot more out there than what we can teach our medical students in 4 years. And that's nutrition. That, I hate to say it, we didn't get a lot of education in nutrition. Even business, we didn't get a lot of that. Is looking at things differently. And, people talk about we're doing this quote unquote alternative medicine. Mm-hmm. When you really look at the history of the things that I do, it's not really alternative. It's actually things that had been used in the past. And then prior to the Flexner Report and Big Pharma and those things coming in, those got pushed to the side. So I'm just blowing the dust off of them and bringing them to the forefront again and figuring out how to use them to the best of their ability.
Well, and it sounds like it's really the core of what the medical field was intended to be. Mm-hmm. Obviously you're going to treat a patient who has a broken arm or has the flu or whatever and help them get back to, being able to function and move. But it seems like medicine, even watching old TV shows, the doctor shows up and anyway, it just seems like the practice is really the boilerplate of helping people feel the best they can be and stay healthy for the longer term.
Absolutely. And I think you kind of alluded to, there's a good reason to have Eastern and Western medicine. I mean, you're absolutely right. Don't come to me if you're having a stroke or a heart attack. Don't come to me after a bad car accident. That would be my former emergency medicine life. But this is like the other side of how do we want to stay healthy? How do we want to be? So there's a good complement of both. Got
it. Okay. So if people engage you in your practice, obviously they would show up and say, I heard about you on this great podcast called Michigan Reimagined, and I'm curious. I'd like to be a patient of yours. You talked about going through all of the measurements and all the things that to get them onboarded. But what is a typical patient going to experience in your practice? How long do they continue to go to you? Is it a relationship that lasts a long time, or is it a 30-day assessment and go out and live this way and you should be okay? Right. So when you come to me, I would like to spend at least an hour and a half, 2 hours getting to know the person, getting to know what is their history, what am I working with? Because I can't fix them if I don't know them, right? So I call that my wellness consult. And after that, then I will determine, okay, do we need to focus on hormone replacement or diets? Are we working on, I kind of get it from the patient. What are they looking for? And then from hearing what they tell me, I will start recommending and instituting treatments that way. I would like for it to be a long-term relationship. And one of the things I always tell people is, nobody likes to be on medicine long-term. Nobody likes to be on certain things long-term. But if we can work with our bodies to help support the best that we can, maybe we can reduce the amount of medications. Maybe we can get them off completely. But that just depends. Everybody's a little bit different. So there's not really a one-size-fit-all per se. I do have some athletes coming in. I do some other things called this. It's funny. It's called the superhuman protocol. Okay. Everybody wants to be a superhuman, right? But we looked at it with athletes, but really it can be anybody who is just wanting to get back into shape and get their metabolism going. So that's kind of how you come in is we do an assessment. We see where you're at. I do look at labs. I do look at hormones. I do look at your adrenals, which is cortisol because that's a stress. And I do try to fix those things while I'm working with other, the health and wellness, because I can't get you stronger if I don't fix the foundation. Right on. Makes a lot of sense. I want to give a nod to another one of our friends. Triterra is a well-respected environmental consulting firm headquartered in Lansing, Michigan, with staff around the state to serve your brownfield redevelopment, environmental consulting, and natural resource management needs. Since 2008, Triterra has been successfully assisting a wide range of clients by implementing effective solutions to complex environmental challenges. If you're a developer, a property owner, a business, a lending institution, an attorney, or a governmental entity looking for a creative solution and want prompt and timely service, contract my friends at Triterra. Led by CEO and visionary Don McNabb and leaders JP Buckingham and Dave Van Haren, and their dozens of technical experts you can't miss by calling them at 517-702-0470 or check them out at triterra.us. They mean it when they say it's not just what we do, it's who we are and how we do it. So you mentioned athletes. So so a faction of your base is people who are already in pretty good physical form and want to be as best as they can. And then there's people out there that are damaged. You see them in the shopping malls and in grocery stores and out in the public who really have mobility issues and obesity issues. And just, you can only imagine what the pill cabinet looks like in some of these houses. Is there, but you feel like you can really help them both?
I can. I really do. I recognize both sides of that. So I started with running 5Ks, moved on to triathlons, which then was like, oh, that was easy. Then I went to marathons, and I actually started running ultra marathons.
Oh.
So I see that end of it. And then my son plays college hockey, and my girls have been high level lacrosse and divers. So I see that. But then I also look at the other side of my family, my father who had cancer and my brothers who have illnesses, and see where they needed to come from to get started and get moving that way.
Okay.
So I do see both sides of the coin, and that's what I like to do, is try to tailor my care so it's not a one size fit all.
Right. And I got to ask, is this type of treatment, is engaging with you often covered by insurance or never covered by insurance, just so I can have an idea?
Sadly, it's not covered by insurance. And what people will find out is a lot of the wellness out there, for some reason, is not covered by insurance.
Got it. Okay. And so is it kind of like a monthly fee, or is it by service fee? I mean, generally, I don't need you to quote prices or anything, but how does an engagement with you look like?
It would start with a service fee. And then if we can get you on plans, and that way, I think it'll be better, because I can figure out a way to help monetize it and make it more cost affordable.
Yep.
And that's my goal, because I want to help people, right?
Right.
So if I can get people on a program and they can stick with it, then hopefully that'll be a better way for them.
Got it. And does your facility have what you might see in a physical therapist? Like, do you have like exercise or mobility places to practice, or how do you kind of let them leave with things that they can do to help increase their flexibility and mobility?
It's not exactly like a physical therapist's office. It does have separate rooms for the different treatment rooms, and then separate room for my red light therapy, that kind of thing. I do have one room where we do the superhuman protocol, and that's where they do some of those things. But really, it's to get them started, and then get them keyed in with a exercise person or workout place. And then I like to work with the PTs, those types of things. So they can't do it in my facility. I wish I had that capability. Not quite there yet.
Yeah, that's fine. That's fine. And so is this a crowded field, or do you find more and more of your peers kind of saying, I want to go this way because this is where I think the rewards are?
I think the field is a little mixed. So I think there's people dabbling in little pieces and parts. And so when people go to websites and different websites, you'll see, oh, well, so-and-so offers this, so-and-so offers that. What I really tried to pull together was my vision of a plan and bring it all into one place.
Got it. Makes a lot of sense. So how can people learn more about all the services that you provide? What's the best way for people to get in contact with you to set up their initial appointment? They
can go to my website, wellnessalternativesmi.com, and they can fill out a jot form and reach me. They can also reach me at 517-719-0730.
Fantastic. And you're in Okemos?
Yes.
Wonderful. Excellent. Well, is there anything else that we haven't unpacked that you want to share with our audiences as we wrap up?
No, I'm just excited to work with people. I'm new, so I've only actually been in my office for about 4 weeks, so I'm ready to take it on.
Right on, but you're certainly not new to the mission of trying to get people to be better.
Correct. I'm new to my facility.
Right on. That's fantastic. We've been speaking with the founder of Wellness Alternatives in Okemos, Dr. Janet Ng. I really appreciate you sharing your story with us today.
Well, thank you for having me.
Absolutely. And I'd like to give a final shout out to my loyal sponsors, Forsberg Real Estate, Wagoner Financial, Triterra Environmental, Good Marketing, Keller Williams Advantage and Team, Michigan Rise, and the attorneys at Foster Swift. These are all fantastic people worth the call. And if you found the show as a one-off, I want to remind you to follow and subscribe to Michigan Reimagined on YouTube, Facebook, Apple Podcasts, Google Podcasts, Spotify, iHeartRadio, and pretty much anywhere you find your podcasts. This is Chris Buck signing off for Michigan Reimagined.